I am retired. I worked for the newspaper in Bel Air for 41 and a half years, and I've lived in Bel Air since 1946. My first impression of Dr. Mackey was like a son. He was just so friendly, and whatever he explained in a language that I could understand. Dr. Mackey informed me that there was a spot on my liver, and that he would like to take a biopsy of it, which he did, and it proved positive.
I told him that he had a tumor in the liver. Cholangiocarcinoma is one of the disease processes that is primarily a surgical condition.
I had no idea what was coming or what was going to be happening. And Dr. Mackey was superior in telling me what we had to do.
He explained to us what he's seen, and we knew that this had to be done.
The best determinant of his outcome would be if we can get this out surgically.
This is where he was showing me how the operation was going to go.
He was just so professional about telling us and what we should do and how soon we should do it, which he didn't waste any time of doing it. And then Charlie and I both agreed to go ahead and have it done.
I met with him, his wife, and his daughter on several different occasions. His family was incredibly supportive, which I think made his decision to move forward with surgery a little easier for him.
Dr. Mackey, when he explained this to me, what he was going to do, he took all the anxiety out of the operation. I had all the confidence in the world that everything was going to be fine.
The tumor itself was located right in the middle of the liver. And so one of the challenges that we have with liver surgery is leaving enough functional liver remnant that the person can function appropriately, and the liver can function appropriately.
Oftentimes we would have questions, lots of questions. We understood that we could not always call Dr. Fraiman and Dr. Mackey and expect them to be there every time we called. Their entire staff understood what we were going through as a patient and as the patient's family. The entire staff would immediately take the messages, give us some relief, some comfort, would communicate with us, and let us know that they would make sure that the messages got to both doctors and that somebody would get back to us. And if they couldn't, that somebody in the office would. And it always happened, every time. So again, we never felt lost, we never felt left out, we never felt that we weren't important.
We want to make sure that they're taken care of and that they can rely on us. That's what makes us stand out over everybody else.
They made me feel so much at home when I would go in there for a visit. Debbie she checked with you every time you come in there. You know, she talked to you and made you feel so great.
Throughout the entire process, the most comforting feeling was knowing that Dr. Mackey and Dr. Fraiman both were his doctors.
Angels without wings. These two guys are my heroes. And they gave me an extension on life that I probably would have never had. And they are the ones that brought me back around and gave me my life back.
The Liver and Pancreas Center. Hope at the University of Maryland, St. Joseph Medical Center.